Good morning. Yeah, first, before I start, I'll just tell you something that has happened to me a few days back. I was posted in the theater, a 5-year-old child. She had come for a surgery on her hand, which was to be done under general anesthesia. Well, the child was brought in. Along with my team, we secured an IV line. We induced her, intubated her, and everything was going on well. All the monitors were attached and she was connected to the ventilator. The child was prepared and the surgeon was about to start the surgery when suddenly there was a problem. Her saturation, oxygen saturation, which was 100, had started falling or had come down to 94%. So we immediately, and it was still falling further, immediately we switched over to hand ventilation, increased it up to 100% oxygen, and our technician had gone to get the ambu bag. Meanwhile, the saturation was still falling further. By this time, it was around 80, 88, 86, it was still falling. And we were not able to ventilate. Meanwhile, we checked the circuit, the tubings, and we found that one of the connections had become loose. And the moment we tightened, our problem was solved. We were able to ventilate the child, the ETCO2 monitor reappeared, and the tidal volumes were maintained, and slowly her saturation, which had become 80%, started rising. And in about a minute or two, it had become 100%. So what had happened? Yes, we had an emergency. That is, we had an equipment malfunction. So we had something which would have become a disaster if we had not acted immediately. And that is what I'm going to talk to you about in the next few minutes. That is some of the emergencies which can occur in the theater. I'll be telling how you should respond and how you can be prepared for them. A list of some of the emergencies which can occur. Now before I start, I'm sure that in all our operating rooms, you will have all this. The necessary airway gadgets needed for mask ventilation and intubation. So, in our theater, we have a trolley like this, where all the anesthesia equipments, like the mask, the line, are all kept in a trolley. And in our OT complex, we have the more sophisticated things, such as video laryngoscopes or the fiber optic bronchoscope and the defibrillator. Now coming to the emergencies. Anaphylaxis is an acute and severe allergic reaction to an antigen to which the body has become hypersensitive. It may occur within seconds or minutes of exposure. It can be to the drugs, then to the IV fluids, antiseptics. It can be, or to the blood products. It can be due to anything. And this is how you can identify that an anaphylaxis occurred. There will be rash and erythema or redness of the skin. The patient might complain of a difficulty in breathing. The saturation might fall. You will be finding it difficult to ventilate due to the increased airway pressures. The heart rate may go up, the blood pressure will come down, and worse still, the patient can go into an arrest. So if that, what happens or how will you respond when something like an anaphylaxis has occurred? The first response should be, you must remove the triggering agent. Then, if the patient, make the patient lie flat and raise the legs. Start high flow oxygen. You might have to start the IV fluids. And meanwhile, keep ready adrenaline, which is the drug of choice for anaphylaxis. Steroids, antihistamines, and make sure that your airway trolley and emergency drugs are all ready at hand. Another emergency is cardiac arrest. which is the failure of the heart to contract effectively, leading to a cessation or stoppage of the normal circulation and organ perfusion. It can result in loss of breathing and consciousness. There are various reasons for why an arrest can occur. It can be due to a cardiac abnormality, or it can be because of hypoxia and an airway obstruction. You can have a pulmonary embolism. The patient might be in shock. Then could be because of the surgical handling or because of the drugs. Or it may even be due to a high spinal. There are various causes. The arrest is diagnosed by an absent carotid pulse for more than 10 seconds, an abnormal ECG rhythm, and an absent waveform on the monitors. Once a cardiac arrest is recognized, you must follow the BLS ACLS protocol that will be dealt with in the workstation. And the most important thing is to start an effective cardiopulmonary resuscitation. That is, effective cardiac chest compressions should be started at the earliest. And keep ready your drugs like atropine, adrenaline, the IV fluids, vasopressors, your airway trolley, crash cart defibrillator, and the warmers should all be ready. Malignant hypothermia is yet another emergency. It is a severe reaction to the anesthetic drugs, that is the inhalation agents and succinylcholine. It is characterized by an increase in the heart rate. There will be an increase in the EtCO2 and a very rapid rise in the body temperature. There will be muscle rigidity because of due to spasm, and more in the jaw. The jaw muscles will become spastic, and the cardiac arrest may even end up in a cardiac arrest. Now, again, what do you do? As soon as a diagnosis or suspicion of malignant hypothermia is made, remove or discontinue the anesthetic triggers. Increase to 100% oxygen and increase the minute ventilation to wash off the excess carbon dioxide. And you must actively cool the patient. Dantrolene is the drug of choice. And so how can you be prepared? You must keep ready cold IV fluids, ice packs, then drugs such as sodium bicarbonate, calcium, glucose, insulin. All this might be needed. Another emergency will be due to the hazards in the theater. So there are different types of hazards. You can have physical hazards, which may be due to the injury, such as you can slip over the wires, or you can have an accidental injury while dealing with the sharps. I'm sure all of you must have injured your fingers or hands while trying to open an ampule. Then there are chemical hazards due to the exposure to the anesthetic drugs and gases. Then the biological hazards due to exposure to HIV, it could be an hepatitis B or C virus, and the most recent COVID virus. And electrical hazards. But I will be specifically talking to the hazards associated with handling a compressed gas cylinder. The hazards or the dangers while handling compressed gas cylinders are of two types. It can be a mechanical hazard and chemical hazard. The mechanical hazard is because of the high pressure under which the gas is compressed in the cylinder. And the second point is, the cylinders, due to the weight of the cylinders. The cylinders are very heavy and awkward to handle, and unless you are experienced, they will fall down. And if they fall, they will crush anything in the way, even if it can be the containers, or you can break your bones and so on. And the chemical hazards will depend on the type of gas contained in the cylinder. If it is a combustible gas like oxygen or nitrogen, which is going to leak, then that can even result in a fire explosion. And the damage caused by falling cylinders, that is the most common. And The problem associated is any small leak or damage to the wall that can result in the leak, that is a small, large amount of the vapor will quickly fill and spread a large area. So all this can be prevented by handling and storing your cylinders safely. So there are certain etiquettes as to what you should do and what you should not do while handling the cylinders. First thing, make sure your cylinders are secured. It should be strapped to the wall, either chained or strapped using wall brackets. Then, whenever you are transport it using a cylinder trolley. Label your cylinders properly, whether they are full, empty, or whether in use. Then, what is the gas that is being kept in them, and the cylinders must be kept always in the upright position. And when you are not using, close the cylinders. Check regularly for the damage and leaks of the cylinders. And what should you not do? You must not use a leaking cylinder and never roll or drop or drag the cylinders. As you can see from the picture, that is, you should definitely not do it because that can damage your cylinder walls. And never wipe the cylinder with a cleaning agent and do not hammer the valve. And never cover your cylinders with the drapes. A small leak, you might not detect it, that can cause pooling of the oxygen or the inflammable gas, and that can also lead to drapes. So handle your cylinder as you would handle a baby. You must be that gentle. The next emergency is the equipment problems. This is the problem or the emergency that I had. Now, the most common problem that you can face is a leak within the anesthesia machine or the breathing circuit. You can have loose connections, a damaged breathing circuit, or there can be tears in the reservoir bag, or there can even be a wrong placement of the soda lime canister. Now, how do you detect or how can you find out whether there is a leak? You will find that there is inability to ventilate, the bag will be collapsed and the bellows will not rise, a fall in the EtCO2, the tidal volumes and the saturation will all be coming down. If that occurs, switch over to hand ventilation, check your tube cuff, then see if there are any disconnections. Start 100% oxygen and ventilate using an ambu bag. Remember, patient safety is your priority. And if needed, you might have to change the anesthesia mixture. Keep ready your ambu bag and airway cart. Now, difficult airway. This is a situation where a trained anesthesiologist has difficulty with mask ventilation or tracheal intubation or maybe even both. It can be due to various reasons. An obese patient due to some protruding tongue or maybe some deformities or swelling on the face, neck. It can be due to burns of the face, trauma of the face, or maybe the patient has had an history of some radiation to the face and neck. And if the patient says that he's got a history of difficult airway, then again you must watch out. Here again, be ready with your basic airway gadgets. In addition to that, you must have a working suction apparatus. And sometimes more advanced gadgets, that is the video laryngoscope, intubating LMAs or the fiber optic bronchoscopes might be used. And rarely the tracheostomy might have to be done. So be prepared. Now, laryngospasm, that is the closure of the vocal cords resulting in partial or complete obstruction. It occurs usually during the airway manipulation, extubation in patients with respiratory infection, in the ENT procedures, or when there is secretions, blood in the airway. So this picture shows how a normal vocal cord looks like and how it looks like when a laryngospasm has occurred. Now, what happens? You will find that there is signs of airway obstruction, paradoxical chest movements. You will not be able to ventilate and there will be no chest movement. The patient will start to desaturate or there will be a fall in the oxygen levels. Patient will become cyanosed and can go into bradycardia and arrest. So in that case, what do? You must again respond rapidly. Try to open the airway by using the airway maneuvers, that is the jaw thrust and chin lift. If there is blood secretions or vomit, suction it out. Give 100% oxygen using a mask and give PEEP. You might be required to deepen the sedation, paralyze the patient, and if it is still not improving, the patient might have to be intubated. So be ready with your face mask, oral airway, propofol, succinylcholine, atropine, your suction apparatus, and the intubations all must be ready. Now, aspiration. Aspiration is entry of the oropharyngeal and gastric contents into the larynx and the respiratory tract. It occurs in patients who do not have sufficient protective reflexes. It can occur during emergency procedures when there is inadequate fasting time, in bowel obstruction, trauma cases, and in pregnant patients. At that time, you must be aware of how to give the cricoid pressure. That is, pressure is applied on the cricoid to occlude the esophagus. If your patient happens to aspirate, immediately give a head down tilt, do oropharyngeal suction, give 100% oxygen, and you might have to intubate the patient. So be ready with your suction, intubation apparatus, and the Riles tube might also have to be put. Now the last emergency that I'm going to talk to you about is the airway fire. This is a fire that occurs in the airway of a patient who is undergoing surgery. May or not include a fire in the breathing circuit, and it is common in the head and neck surgeries or in the ENT procedures. Now for a fire to occur, you need three components. First, there must be something to start the fire. That is the cautery or the light cords. That will act as an ignition source. Then there must be something to support the fire or burning. That is our oxygen. And the third is there must be a fuel or something to burn upon. And that is could be the drapes, drapes or alcohol preparations, or even the patient's own hair. So for a fire to occur, all these three things must be there. And a fire so remember, a fire can occur anywhere which has been prepared by alcohol, can occur while cauterizing the abdomen. The drapes may be burnt or ignited by light cords and cautery, and it can also be the ground cautery pads catching fire. Now what do you do or how do you prevent? Reduce the oxygen concentration to the minimum required. For the high-risk cases, use the endotracheal tube or the laryngeal mask airway. Avoid tenting of the drapes because oxygen can pool in between. Then use moist or wet sponges and gauzes, and never allow the alcohol to drip and pool. And before using the cautery, the alcohol must be dried. And the hair must be coated with water-based gels. You must have seen that in the during the ENT procedures for the mastoid surgeries and all, the surgeon or the assistant, they will usually coat or they will keep over the hair from the field using soap and water, a mixture of soap and water. So that is to reduce the chance of an airway fire occurring. Now again, respond rapidly, cut off the oxygen flow, tear off the burning drapes, flush the area with saline, and last, use a fire extinguisher. So always be ready with a 50 ml syringe filled with fluids, filled with saline. Your IV fluids and intubation trolley must be ready. Now a video just to emphasize what I said. Sorry. This is how you can use the fire extinguisher. 4 techniques. Pass, that is pull the handle, then aim the nozzle, squeeze the handle and sweep it side to side. In case, just for a revision. Before I conclude, there are 4 things that I want you to remember. First thing is, whenever you have an emergency, never panic. Second thing is, you should never hesitate to call for help. Third is, make the patient your priority, not your ego. And the fourth is, ensure safety for all. It should be a safe surgery, a safe patient, and a safe healthcare professional. So, thank you. Hope you all have a safe, hope that everyone has got safety. Thank you.